And we're going to go ahead and start here. All right, so like I said, this is our first module where we've introduced the course, which was really looking at the syllabus. We've done that already. And now we're going to introduce sport and exercise psychology. So although the class is not called sport and exercise psychology, it is called psychosocial aspects of sport. I think because the text is called, essentially sport and exercise psychology, we can really, for our purposes, look at those two things as meaning the same thing with some differences, which we'll talk along the way. So let's define sport and exercise psychology. So we define sport and exercise psychology as the scientific study of people and their behaviors in sport and exercise activities and the practical application of that knowledge. So really most of what we'll talk about throughout the semester is directly tied into behavior. Particularly, we might say something along the lines of when we look at psychology, one of the things that sport and exercise psychology really focuses in when you think about psychology as a whole is, again, that behavioral piece of psychology. Another spin on the definition is taking behavior, but also seeing how behavior is in effect, or I should say, is a part of the ABCs of psychology. What are the ABCs of psychology? Well, they are right there in front of you. A stands for affect, B stands for behavior, C for cognition. Sometimes you might see a D and an E thrown in there as well. And when you look at this, all this really means is how someone feels, how their emotions, how their mental state affects what they do. And then based on what they do, also thinks about how their behaviors may have a relationship with the things that they think throughout. So again, maybe a little abstract in terms of how I explain it, but looking at, again, the ABCs of psychology, affect, behavior, and cognition, sometimes within a dynamic and, again, ever-changing environment, because we know in sport and exercise in particular, environments are very constantly changing. It's important to say, okay, those are the key pieces, the main overlapping criteria from psychology that really start to make up sport and exercise psychology. So what we're going to do now is we are going to listen to Dr. Dan Gould, who's actually one of the authors on the text. And from his perspective, he's actually going to define sport and exercise psychology. Again, probably the definition will be very similar to what I just showed you. But more so than that, he's going to and it's a short video, not a long video by any means. He's also going to highlight two key objectives of sport and exercise psychology. Why is this stuff important to learn? Why are you taking this course? Why is this something that's worth diving into? So we're going to listen to this video now.
Sport and exercise psychology is the scientific study of people and their behavior in the sport environment, and then the practical application of that knowledge to help people enjoy sport and achieve their performance goals. In sport and exercise psychology, we study all sorts of people and we work with all sorts of people. Sometimes people think sport and exercise psychology is just for the elite or Olympic athlete. However, there's sport and exercise psychologists working to help children get a wonderful start in sport, to help the millions of high school athletes in the US. And it's not just sport. We're equally interested today in the health and well-being of all human beings and how we can understand the psychology of that, whether it's using psychological principles to get people to exercise and engage in healthy behaviors, or to understand the results of exercise and the influence it has on people's psychological well-being and development. There's two general categories of objectives to sport and exercise psychology. So always remember, sport and exercise psychology, first we look at how do psychological factors influence people's performance in sport and other human performance settings. So how does your psyching up or you're mentally preparing help you perform in an event in sport? How does coaches' reinforcement influence in your behavior? The other question we look at is what effect does participation in sport and exercise have on you psychologically? So if young children play sport, do they develop character, good, positive personality traits, or do they become characters and sort of deviants? What effect does exercise have on the cognitive functioning of ADH children? What effects does exercise have on all of us in terms of reducing anxiety and depression? These are the kind of topics we're going to deal with in this class. First, on one hand, we'll talk about what effects psychological factors have on performance and functioning. And then secondly, again, look at what effect participation in sport and exercise has on people's psychological well-being.
Okay, so I thought that was pretty nicely said. And then what we can do, just bear with me here. Okay, what we can do is, again, we could summarize what he shared with us into these key objectives. So again, these are the objectives of sport and exercise psychology as a whole. One, to understand the effects of psychological factors on physical and motor performance. We think, again, that's something that's huge because we know that everything that's done in a weight room, everything that's done from speed, agility, quickness training, and everything else in between from a physical standpoint isn't the whole picture. Again, we need to understand the psychological factors when we talk about these types of things in sport. Second objective, understand the effects of participation in physical activity on psychological development, health, and well-being. So it's no surprise that there are so many advantages and benefits to being physically active. And every time I teach these types of courses, I like to remind people that physical activity is always important and it's relative to the individual. So for some, think about elite athletes, their physical activity constitutes of hours and hours of training every week. Whereas for other individuals, their physical activity may consist of attending the gym every now and then, or a couple times a week, or being active on the weekends, or going for walks, or swimming, or jogging, or biking, or going on hikes, et cetera, et cetera. So obviously, it's varied, and there's a gamut of how we define physical activity. So if that's the case, it goes without saying that, as you saw in the video from Dr. Gold, sport and exercise psychology, it's not just for our elite athletes, not just for collegiate athletes, not just for high school athletes, not necessarily just for athletes, but more so for anyone really participating in physical activity. And even for those that are not, we can use educational components of sport and exercise psychology to educate those into, again, the importance of and the advantages of physical activity. So let's break those two objectives down. You saw as part of the video, Dr. Gold mentioned some questions that we may tackle. Here are some examples of some other questions that you might see related to each objective. So you might ask yourself these questions, or you might develop these questions in your reading. And if you do, or if you're interested in any of these topics, not only could they potentially make good research paper topics, but they're tied into that first objective of sport and exercise psychology, which is to understand the effects of psychological factors. Our second objective, again, which is to understand the effects of physical activity participation. Maybe we're looking at these kind of topics. Again, could be good topics for your research paper. These might be questions that you start asking, questions that maybe you already have, or you start asking yourself as you go in through your reading and you dive into the materials. I cannot stress enough that when we think about sport and exercise psychology, of course, we just look at the name on a broad basis and we may think that, again, it's something that only works for athletes or elite athletes, but it's not. It's something that, again, is for a broad population base. Look at these different groups of individuals. We have older adults, children, exercisers, elite athletes, recreational athletes, coaches, teachers, fitness leaders, etc., and so forth. So pretty much everybody. And again, even those that don't stress or don't encourage physical activity in their own lives, they should, or at least some level of it And again, there could be an educational piece of sport and exercise psychology to encourage those, particularly looking at our second objective and explaining to them, hey, these are the benefits of you participating in physical activity, however it is you want to have that physical activity. So, thinking about individuals that call themselves sport and exercise psychologists. Now, there are really three types of sport and exercise psychologists, and we could talk a little bit more about their training in a short while. But people who call themselves sport and exercise psychologists, they're typically one of three versions of that profession. They could be in the research version, the teaching version, and the consulting version. Obviously, I would imagine that there would be some individuals that can kind of intermingle between the two. When we talk about research, these types of individuals, again, they're doing research. A lot of times this becomes common in academia, right? Higher education institutions, universities. And what these individuals do is they may be doing research on a court, on a field, in the lab, and they are publishing, they are presenting, they are publishing journal articles, and so on and so forth. They're advancing the role of the sport and exercise psychologist, but at the same time, they're advancing the profession by hopefully getting some answers, even if the answers are not always clear cut, but at least the start of some answers to some of these questions and many others that are related to the topic of sport and exercise psychology. Teaching, that's something that's similar to what I'm doing. Obviously, I'm not necessarily a sport and exercise psychologist. I do have a psychology degree. I have some additional other certifications and degrees and whatnot. But obviously, it's not uncommon to have sport and exercise psychologists in this role. Teaching in a university course, whether it's in a psychology or exercise or even exercise and sports science department. And the third role, the consulting role, this is the role I think probably gets the most publicity. Probably when you hear of teams hiring sports psychologists to work with them, whether it's at the college level or the professional level, this is typically what you think of. But again, just keep in mind that it doesn't have to be just at those levels. And what you see here are individuals that work specifically, typically performance oriented, um, to make their performance better, to maybe help them recover from an injury, to help them, deal with a certain traumatic event that occurred, whether it's an injury or something else that's causing their performance to lack. So again, that's something that you would see on the consulting side. When we talk about specialties, obviously, as you saw before with the roles, there's intermingling between for a lot of these individuals, but there's really two distinctions when it comes to what a sport, or I should say, who a sport and exercise psychologist can be. A sport and exercise psychologist can be a clinical sports psychologist, or a sport and exercise psychologist can be an educational sports psychology individual. One of the biggest difference here is that one is licensed to really start getting into the aspects of diagnosing mental health conditions, and one is not. That's really the clear difference here. And of course, when we talk about licensing and so forth, we're referring to clinical sports psychologists. And now, to clarify this a little bit, I have some information here for you. So clinical sports psychology, again, a specialty within sport and exercise psychology. These individuals are licensed psychologists. They're trained to work with people with severe emotional disorders, and they can treat things like eating disorders and substance abuse, versus on the other side of the spectrum, just educational sports psychology specialists. They may do some consulting, but it's not, again, at the level of mental health care necessarily. They focus on human movement, particularly as it relates to how psychology is affecting human movement. They may have training in physical education, kinesiology, exercise, sports science, and their big ticket, I would say their big ticket item on their agenda is education and increasing awareness of issues such as you see here: anxiety management, confidence development, uh, imagery, different things that they may be able to use in performance. So what you see commonly are individuals who are educational sports psychology specialists. They, once they realize that there's a much bigger underlying issue, or that an athlete or someone who they are working with needs some additional help or guidance, they may refer that individual to a clinical sports psychologist. So it's not uncommon at all for these two specialties to work very closely together. And what ends up being helpful sometimes is when an athlete who is dealing with a mental health issue that's very closely tied to their sport, or maybe it's being manifested because of their sport, or being enhanced because of their sport, for them to work with a clinical sports psychologist as opposed to a traditional clinical psychologist, because again, they have, that being a clinical sports psychologist, a little bit more of an understanding exactly of what is going on in your day-to-day basis, particularly as it relates to that particular sport. So again, terminology, I get it, but again, important to know that overall, again, sport and exercise psychologists have these roles. Many times they're intermingled, intertwined, and there are really two types, two specialties of sport and exercise psychologists. So now, just to kind of tie it all in, we're going to bring in, again, another short video here, Dr. Kirsten Peterson, and she will now pretty much just recap what I just mentioned as it relates to having those two specialties as it relates to a clinical sports psychologist and an educational sports psychologist. And again, just once again, highlight those key differences between the two. So as again, just bear with me here. We're going to flip over and check out our video. Again, another short video here.
Clinical or even counseling sports psychologists are trained in the area of psychology, and so are able and licensable by law to treat underlying psychological disorders, diagnosis like depression, anxiety, eating disorders, whereas educational sports psychologists tend not to be trained in the fields of psychology, and so are not licensed to do those things, but are able, though, to be teachers of skill and educational nature in the area of sports psychology.
Okay, good. Hopefully that helped to summarize some of those points. So we're nearing the end here. Let's go back to just a couple last things that I want to highlight from that first chapter. In the first chapter, there's a lot of dates relating to the historical periods of sport and exercise psychology. I'm not too fond of just asking you to memorize all these dates, but what I will say is a couple of the dates that I will mention throughout the semester, I'm mentioning them because they're important, not only because I want you to memorize them or commit them to memory. That's not, I think, a way for you to learn, but just things that I think will help you, or dates, I should say, that will help you put things into a better historical context. Because history does matter, but I do think that it's not necessarily at this point all that important to ask you to remember a slew of dates. But again, as you read that first chapter, you'll see that there are a lot of dates in there. So just make sure you do get a chance to look at that. Obviously, something I will highlight from this slide is you want to know where we are right now in the discipline. So we're in contemporary sport and exercise psychology, which really had the turning point around the year 2000, where, before that, obviously you look, and your text explains this a little bit more, but in the 80s and the 90s, finally, we understood as a discipline, as psychologists and different sport performers, that there was a lot going on in terms of the psychosocial aspects of sport. In other words, we finally really accepted the fact that in order for athletes and any physically active individual to perform at their best, they need to be healthy and effective in their mind, psychologically, as well as they are physically in their body. So I think that's when that was fully accepted. Again, it definitely made sense to start bringing in different disciplines, psychology, and education, and think about all the health professions that are there, physical therapy, athletic training, so on and so forth. All these things have to mingle in one another to, again, have the best capability for physically active individuals. Couple interesting facts here at the end. Sports psychology specialists are getting a lot and more publicity. They work in more than 70 countries as of today. That's a lot of countries. Of course, this is more common really in North America and Europe. I think that's where you see more of an acceptance of the really importance of having these individuals and knowing what they can offer, particularly to physically active individuals. And although there has been some activity in some other parts of the world, such as Latin America, Asia, and Africa, particularly in the last decade, the 2010s, it really hasn't grown as much as in North America and Europe. But needless to say, the profession is growing. Those two specialties, both on the education side, on the clinical side, those are growing. Something else that I think is pretty cool is sport and exercise psychology as a discipline has provided an avenue for women to be involved in sport. I think it goes without saying that early on, unfortunately, a lot of sport was geared towards a male-centric society. So sport was commonly associated to with males, right, with more masculine individuals. Fortunately, that has changed a lot, especially when we look at now compared to 20, 30, 40, 50 years ago. Women in sport are getting the recognition that they need, and more so than that, women in sport and exercise psychology are they're kicking ass, right? They're making significant contributions to the profession. And when we start talking about different types of theories and findings, you'll be pretty amazed that in not an, I don't want to say an overwhelming majority, but at least half, if not more, of the really, really important things that we'll talk about are coming from women in this field. So again, that's very, very important, and something that I think holds true in many fields, not just the one we're going to talk about this semester, but women's contributions are often underreported in scientific history. So again, fortunately, we don't see that as much, although it does happen. But we have to acknowledge that women have played a pivotal role in sport and exercise psychology as a discipline. And I did mention not too long ago that a couple dates I will throughout the semester that I think are important. I do want you to know these two women. So in the 1940s, we have Dorothy Yates. In the 1970s, 1980s, we had Dorothy Harris. And we're going to spend some time throughout the semester talking about some of their findings as it relates to how it ties into some of the things that we'll cover. And of course, from the 1980s to the present, some of the newer more well-known women in sport and exercise psychology. Uh, their names are there, so you can see that. And of course, some examples of some key international women contributors. And that is it. That is our introduction to the course. Hopefully, that helped you out. Again, please plan on listening to these, watching one of these, on a week-to-week basis. Make sure you stay organized and make sure that you're looking at all those dates in the syllabus. You are asking for help if you need any help. I'm usually a pretty easygoing person. I can be pretty accommodating. But again, if you have anything going on throughout the semester, please reach out. I cannot help you unless I know there is a problem. But that being said, hey, take charge of your education, and I'm here if you need anything. And just because it's a remote asynchronous course, don't feel as if you are on your own, because you are definitely not. So when you're ready, make sure you move on to the next module.